Okay, my name is Makella. This is Magnolia. We're gonna do the task where we collect ear swabs. So, sorry, buddy. What you? Can you see it? You see the ear one? Perfect. Okay, so we've still got sterile swabs here, and we're going to just lightly, so that way we aren't hurting her, hold our head in between my arm, and just softly go down into her canal, and we'll snap this one so we know it's the left one. And then same process on this side. Just gonna hold the ear up, slightly go down in that canal, very gently, get our swabs, and pull them out. And we'll pause the video for just a second so we can go around the corner and start heat fixing and staining. Okay, and now we've got our swabs in a slide with her name, date, initials, all that on it. So we're gonna take our left swab, and this is with the frosted side up, and we're going to just take it and roll it between my fingers. And then we're gonna take the right swab and do the same thing, and just roll it between my fingers onto this slide, pressing kind of gently so that way this stuff, the contents comes off the ear swab and onto the slide. Now we're gonna let it heat fix on our heat fixer for about 30 seconds to a minute, so we'll let that do that. Okay, and now that this has been heat fixing for about 60 seconds, we're gonna take it, we're gonna put it in each of our stains. I do ours here for each stain for 60 seconds a piece. So I'll come back whenever we are ready to switch over to our pink and then to our purple. Okay, now that it's been 60 seconds, we're gonna switch it to our pink. Now that it's been another 60 seconds, we're gonna switch it to our purple. Okay, and now it's been our last 60 seconds, we're gonna take our slide, and I'm gonna take it behind the camera to rinse it off in the sink, so that way we can have it nice and clean before we put it on the dryer. So we'll let this get completely dry, and then we will put some oil on it and examine it at the microscope. Okay, our slide is completely dry, so what we're gonna do is we're gonna take our microscope and I set it to the red 10 setting first and flip it on, and I will take my glasses off so that way I can focus our slide before I put oil on the slide. So now I'll take a drop of oil and we'll put it on each side, and making sure not to touch that slide is key, because we don't want to cross-contaminate our slides when we're doing other patients as well. Okay, so now we've got that done, I'm going to flip it over to our 100X and start looking for any yeast, bacteria, rods, cocci, all those things. She isn't currently having any symptoms of an ear infection, so we likely won't see anything, but we might see a couple, since there are a few bacteria that just live on our skin naturally. I've only seen one cocci bundle so far in the left ear, which is kind of normal, just to have a little. Do this last row. Okay, now we'll switch to the right ear. Seeing one yeast bundle here, or one yeast on that side. Okay, and that's the top of our slide. So yeah, Okay, just to finish up before the video cut off, we've got Trey's coxswain in our left ear, Tracy's in our right ear. So what we would do from this point forward is I'll go into her chart on the computer and notate what I found in her ears, just that way in case in the future she does have an ear infection, we kind of know what her normals are.